This is second live streaming made by Aryong Choi. Okay. Today I want to talk about the yoga therapy for the terminal cancer patients at the hospice center. As yoga therapists, there are many yoga therapists to handle cancer patients, but in my case, I did focus on the terminal cancer patients more than just first, second stage of cancer patients. For me, it was really meaningful work, and it is a kind of karma. I was happy. It is strange. Sometimes my expression is not proper, but please understand my language barrier and my own ideas. For me, what is the meeting of terminal cancer patients is like looking at the dying flowers. This is new flower, but I bought this flower last week. It is dying, but still it has smell. And for me, it is also so beautiful. So my husband is looking at me now, watching at me. My husband complained that I don't throw away many things, but because I want to keep the memory, and many things has life, its own life. So I want to keep that. We are living at the same time we are dying. It is everyone's destination. So at the hospice center or palliative care center, I am just observing some old flower. I think so. For me, their skin, the patient's skin has also lots of wrinkles and gray hairs. Strangely for me, it looks beautiful. When they were smiling at me, I was so happy. Because of that, I think I could keep working for them. 맞아요. 이게 시들었어요. 그렇지만 still it has a smell. So usually in Korea, the hospice center or palliative care center, most of patients are terminal cancer patients. When I work at the Severance Hospital Cancer Center, the university hospitals can keep patients only for 2 weeks, and they need to move other place, and then they come back again. So when I met them, I could just do 2 sessions once a week, and they went to other place and then come back. At that time, they became weaker. Sometimes I couldn't recognize them. it made me so sad. So for me, I wanted to offer yoga therapy for them constantly, continuously, to get better result. So I prefer the smaller yoga, smaller the hospice center. I prefer that than the big hospital. And some hospice center in Incheon, I could have patients to be offered yoga therapy by me for 20 times. 20 times, 20 sessions means I met her longer than almost 4 months, 5 months. She overcome the stroke, and she overcame stroke, and she became stronger than when I met her for the first time. So it was really, really nice experience. There, today I will introduce terminal cancer patients with blindness. She lost her vision when she was grown up. She was blind, but she put some travel photo when she traveled to other countries next to her bed. It was so impressive to me. Originally, she refused the yoga therapy. We need to think of the characteristics of terminal cancer patients. Oh, they are. Usually I thought of liver cancer or lung cancer or thyroid cancer, breast cancer, kidney cancer. Very simple. I heard of very simple cancers, but when I went to the hospice center, there are all kinds of cancers. Cancer patients were hospitalized. So the one main thing in common is they are terminal. And so their body is so vulnerable and fragile, and they suffer from pain. They have a problem physically, severe pain, and they had nausea, and they had paralysis of the body, and their body is swelling, and irregular breathing, and xerostomia, so dry. Their mouth is so dry. Sometimes their lips stick to their teeth. And the intestinal obstruction, they couldn't sleep very well, and they cannot walk. They cannot even sit up on the bed. So, and their level of immune system is so low, and they have many needles in their body. They are lying on the bed with the needles. At that moment, I needed to offer yoga therapy for the patients. I couldn't say, oh, yoga, I should do with them, I should do the sun salutation, Surya Namaskara with them, or if they are lying on the bed, I can't do yoga therapy. I couldn't say that. I needed to do something for the patients. And I don't know how long they would live. They are facing death, imminent death. I am looking at the patients waiting for death. So sometimes, many times, I needed to control my own emotion. I needed to clear my throat like this because I always felt sad. Sometimes I felt depressed. So I needed to manage my own emotion and my own psychological state. I met one patient next week or next day. I couldn't meet her again. At the beginning, I cried a lot, but later, instead of crying, I prayed for them. So I thought they are always living with me. Sometimes they are encouraging me to do something, and they guide me. So I like their souls. So, and I said to I mentioned my patient with blindness. So she has very sensitive hearing and sensitive smell. Except vision, she has much more sensitive than any other person. So, do you know this Elizabeth Kubler-Ross model? Many patients has 5 steps, steps to accept their near death. The first, denial, anger, bargaining, depression, and acceptance. I think many people knows this. So patients suffer from these 5 steps. Their mind, yoga is stop the mind fluctuation. So they have these steps. So sometimes they express anger to the nurses or medical staffs and therapists, or sometimes they don't talk at all. So to deal with the patient's emotion is also not easy. So when I entered the wards, before entering I always had deep breathing by myself. I needed to calm down and I needed to manage my own emotion. And so I entered there. So my patient was 76 years old woman with blindness. So her cancer was very complicated, has a very complicated name. The liver ciliary duct carcinoma. So anyway, for me, she is can do yoga with this weakest body. So, but I did offer the yoga therapy her the other patients next to her bed. So she listened to my voice and the comment of the other patients. And then she asked me, "Can you do it for me?" So I started yoga therapy for her. First, yoga therapy started breathing. Patient has lots of pain. They couldn't sleep overnight. So I said to her, this breathing, if you practice this breathing, you can be better with pain overnight. Please, let's do practice. And when she exhaled, it she also feel relieved. The pain is relieved. So she followed me, and then I also touched her hand because she's blind. She couldn't see, so I touched her hand. So make fist, 주먹 쥐고 inhale, exhale, inhale, exhale, inhale, exhale. So like this, when with the breathing, I made her own rhythm. So practiced this 10 times or 20 times is too much. They are very weak. So if they exercise small things, they feel easily exhausted. So 10 times, then relax, take a rest. And then I do other pose with her feet. Before that, I also give some mantra. I mentioned it, mantra. Because if we do in yoga, we usually do Om mantra, but many patients has their own personal religion, and the hospice center or the palliative care center is run by some religious group, so Om is not allowed. Go. So I did. I divided Om, A, U, So especially for the patients, terminal patients, I do. So close their mouth and then do touch their body by their own hand, or sound. This is good for they can understand, they can feel their own vibrations in their body, inside, happening in their body. And it is very simple things, but when they do, they open their mouth. So I think they feel I am alive. They recognized they were alive through those things. So touch their own face, or here, and then their heart, or their belly. So this is very simple things, but for the terminal cancer patients, it is very, very important. They could feel they are still alive. And I also give some information when they do when they make a sound that makes vibrations. It touches their own body inside, so it is spreading. So it is a kind of massage of your organs. So very very fine massage. So I think they patients can understand what I am saying. So they followed me very well. So for even at the terminal patients hospice center, I divide the patients by age. If they are over 80s, I just give a breathing method. But if they are under 70s, in that case, I want to give more power and more. I wish they don't give up. They don't give. I hope they don't give up. Do something. So when I do breathings, I make I give tips. Make fist and inhale and tighten your anus. It is so funny, but when they are lying on the back, lying down on the bed, at that time they are doing this very very hard. I recognized they are doing this, and I look at their eyes and their body movements. Their body movements are very limited. So lying down on the bed, lying down, and then make fist, exhale, inhale, exhale. So I make a sound, inhale, exhale, because you don't need to make a sound. Just patients, I wanted to give some instruction to patients. So make a fist, exhale, inhale, exhale, and then I also give some very easy breathing method. Except the abdominal breathing and very easy nadi shodhana, except that everything is difficult. So I make their arms on the bed like this. Here is pillow. So one arm is okay. The other arm, we can do that next. We can do other arm next time. So one arm, and then one arm on the bed, on the pillow, and then chin to the chest. Inhale, exhale. Inhale, exhale. Inhale, exhale. And then bend their, lift up their arm and then put it down. And then do it with other arm. Inhale, exhale. Inhale, exhale. Inhale, exhale. And then come back. If they can do both arms, they can put both arms on the pillow like this. Inhale, exhale. Inhale, exhale. This is really effective to open their chest. They open their chest and then deep inhaling and exhale. Deep inhale, exhale. So with this breathing method, they can make their own pace, rhythm for their breathings. So inhale, exhale, inhale, exhale, inhale, exhale, and then put it down. When we do yoga programs, yoga therapy for the patients, it takes just 5 minutes and minimum 5 minutes and maximum 20 minutes, and then they need to take a rest. They need to take a rest, and if they feel so comfortable, they fall asleep. It is very interesting. When I do some yoga yoga breathings, at that time, 그러세요? 그쵸. 지금, 유튜브로 하면서 실시간 채팅 하시는 분이 있거든요. There is a person, 파란 장미, blue rose, 파란 장미, to the live chatting, she practiced this and she said she felt chest opened. Yeah. When you are so tired or you are so weak, in that case, you don't need to raise up your arms. Just open your one arm. Just this is enough. Okay. And then come back. Or next, one arm and then come back. Yeah. And you need to do this right now. So make a fist, relax. Make a fist, relax. Make a fist, relax. So this patient, 76 years old patient, at the first meeting, she refused yoga therapy. I don't do that. And then, but after hearing my voice for the other patients, she asked me to do yoga therapy for her. And I met her 5 sessions. I met her 5 times. So she became better and better. And the 5th session, she said, can you do any other movement? It means that she became better. If she is so weak, she can't ask any other things. So so I really, really strongly recommend to do this. Tighten your anus. That is Muladhara Bandha. In yoga, it is a kind of Muladhara Bandha. When we learn yoga terms, we need to make it easy applications for the patients or the people with disabilities. So this is very easy programs, but when you meet the terminal cancer patients, it is working so effectively. Yeah, this is today's yoga class. I wanted to give a short talk, short introductions for you, and you don't. Many times we need to do very, very wonderful sequence with the yoga movement. But when you took surgery and when you are really, really severely sick, in that case, you cannot do many other movements. just easy pose, easy breathing is enough and very effective. Keep doing that. And then if you became stronger, in that case, you need to move other exercise. You need the next steps. So at the beginning, if you can walk, okay, now you can walk, you can run, but one day you need to do chemotherapy, or you need to do some take surgery. After the surgery and after chemotherapy, you need time to recovery. At that time, please don't do many things. Don't do many things. Just keep breathing and give you power. If you have power, and then you can sit up and you can walk, so you can move to next step. Okay, this is my today's yoga session, yoga therapy for you. No, not for you, not for you, because here in the future, other yoga therapists who deal with the patients, terminal cancer patients, in that case, I wish it is helpful for them. I have, of course, I have some assessment tools, but today I don't introduce that. Next time, I will introduce that to you, and how to check the patient's improvement. I will show how to check the patient's improvement with those assessment tool. Okay, today this is I need to close this today's live casting. Okay, thank you. Namaste. Namaste. 감사합니다.